We'll see when the time comes. Actually, we probably will. Okay. All right. Well, just want to say thank you to everybody for attending. We'll go ahead and get started. It's just a little past 2 o'clock. My name is Robert Muslam. I'm the Housing Authority Administrator for the City of Milpitas. For the past 2+ years, myself and Sarah, who's also on this call, who I'll let herself introduce in just a second, have been managing the CDBG program, the Community Development Block Grant Program on behalf of the city. A lot of the names that we see in the attendees list are all very familiar, some are new. So for those who don't know me, nice to meet you and look forward to connecting with you. Sarah, do you want to just quickly introduce yourself as well?
Sure. Hey everyone, this is Sarah Court. I'm a housing planner with the City of Milpitas. Been working on, the CDBG application and allocation process the past couple years. So today we'll just be going over our new process for this year, and hopefully we can answer any questions you might have. And thanks for joining us today.
Great. Okay. So with that, we're going to just walk you through a little bit of an overview of the CDBG program. For this, for a lot of you, might just be stuff you already know, but then towards the end, we'll get into our process for this coming fiscal year. So with that, we'll get started. And okay, so quick overview of the program for those who are newcomers to the CDBG world. CDBG stands for Community Development Block Grant. These grants are administered by Department of Housing and Urban Development, lovably known as HUD. The city's fiscal year for the activities that we provide or that we approve with the funding is July 1st through June 30th, and that is every year in line with our fiscal year. So all of the applications that we receive are for approval between July 1st, when the activity can start, and June 30th, when in theory the activities end. The application window for this year's submissions started February 8th, so we're a couple of weeks through at this point, and we'll go all the way through March 21st. So the eligibility guidelines require that any eligible entity be a community-based agency that serve low and moderate income Milpitas residents. That is the crux of the CDBG program, is that it must serve low and moderate income residents in any eligible jurisdiction. Typically, they're a 501c3. They're incorporated with the Secretary of State. They possess a DUNS number, and every activity or project must meet one of the following 3 national objectives, which I'll get to in the next slide. So these are the 3 national objectives: low and moderate income, slum blight, and urgent need. And I'm just going to touch really on low mod, and then I'll kind of briefly talk about slum blight and urgent need. Low and mod is the basis of the program. So they're broken down into a few subcategories. The first one being area benefit, which is usually an area where it can be determined that at least 51% of the residents are LMI persons. So a good example of this could be an affordable housing development requesting a public service. So it can be pretty reasonably determined that at least 51% of those residents would fall under low and moderate income by HUD's definition. Limited clientele is actually what most of you apply for and falls under a few other subcategories. The first being presumed benefit. These are clients that are generally presumed to be low and moderate income. And just as some examples that HUD provides, they use abused children, battered spouses, elderly persons, severely disabled adults, and homeless persons. So we can say if your activity is benefiting one of those groups, that it's presumed that those individuals would be low and moderate income clientele. And then the other low and moderate income clientele are simply individuals that don't fall under these presumed benefit categories, but that are still low and mod by HUD's definition. And an example of that would be like our rent relief program, which goes and assists low and moderate income individuals who are at risk of eviction or displacement. Those don't fall under one of the presumed benefit categories, but it is a low and moderate income clientele that we serve with CDBG funds. Under housing, the housing category of LMI qualifies activities that are undertaken for the purpose of providing or improving permanent residential structures, which will be occupied by LMI households. So at this point, it's starting to get a little niche. We don't see a lot of activity in that space in terms of applications. And then the last subcategory being jobs, low mod job creation, it's just designed to create or retain permanent jobs. Again, we don't see a lot of applications in that space, but it is an available national objective that you could qualify for one of your activities. Moving on to slum and blight. Basically, slum and blight is a designated area where an activity is going to occur, but it must meet a definition of a slum, blight, deteriorated or deteriorating area under state or local law. To my knowledge, we have not had any applications for that national objective. So, we just wanted to alert you that that is a national objective that you could, in theory, apply for, but we just don't see a lot of activity under that national objective. And finally, urgent need, which I think is interesting and somewhat misunderstood. This is essentially disaster relief under HUD's guidelines. So it's really for natural disaster relief. And every year, we get a few applications under urgent need, and all of your activities are certainly urgent. We really do believe that. But unfortunately, they don't qualify under this category. And just for some context, HUD determined that COVID-19 didn't fall under urgent need. So that should just kind of tell you how how they view urgent need, that it really must be a true natural disaster, hurricane, earthquake, etc. Okay, so we're going to move on. Just wanted to give you a little bit more detail on the national objectives. So each eligible activity must, again, meet that national objective, but at least 70% of the expenditure must benefit low and mod residents. So that's something that we look at when we get your quarterly reports. We take a look and see how much of the expenditures have gone to benefit low and moderate income residents. The last few years, I believe our number has been above 95%. So that's really good, but the threshold for HUD is 70%. The costs must be necessary and reasonable, and specifically for COVID-related activities, and this is key, as we'll discuss a little bit later. They must prevent, prepare for, and respond to the coronavirus. And that's really critical. And we'll talk about that a little bit later as to why it's so critical. So this is a list of all the potential eligible activities. We really went through the HUD guidelines and really tried to just get every possible, item that we think would be relevant for you to see and see what you can apply for. I won't read them all. I'll leave this up here for another 10 to 15 seconds. But we will be sending out this PowerPoint after this webinar, so you'll be able to look at these a little bit in more detail. We just kind of wanted to show you sort of how varied the potential activities are. Similarly, some ineligible activities. Again, I won't read them all, but essentially, the things that pop out are political activities, government expenses. Those types of ineligible activities are ones that HUD really looks at. So we'll leave this up again for another 10, 15 seconds. And again, you'll see this in the PowerPoint that we send out to you, but just kind of wanted to highlight some ineligible activities as well as the eligible ones. Okay. All right. So last year, through the CDBG CV process, when we were allocated additional funds through the CARES Act, and we had new activities that we needed to fund that weren't in our consolidated plan. And actually, I apologize, let me take a step back. Our consolidated plan is a 5-year outlook. So HUD requires every 5 years for us to put together a plan as to what we believe the community will fund, the city council will fund over the next 5 years with CDBG funds. And so part of this consolidated plan is to put priorities in place, and all of your activities must in some way, shape, or form fit into these priorities. And so Last year through the CDBG process, we updated the consolidated plan. We made an amendment to the consolidated plan to add a few priorities that would assist us in using the CDBG funds. We also took this as an opportunity to make it very clear as to what some of our priorities were. Some of them were really broad categories, and we broke them down into more specific categories because the community really funded those types of activities. Wanted to be very clear about our intentions with CDBG funding. So as an example, we added residents at risk of eviction to fund our rent relief program with CDBG funds. And then we broke out domestic violence prevention and support because there was so much funding going to that it really warranted its own priority. Similarly, with senior services, we did the same thing. These were all part of a broad public service category and public service priority. So we thought it would be best to break those out. And then finally, we added micro enterprise and small business as a way to support the micro enterprise program that was created out of CDBG funding. So again, these are the priorities in our consolidated plan. For those interested in knowing, this is the last year of our last consolidated plan. And so next year we will be working on a new consolidated plan, which I can tell you is going to be a lot of fun. Yeah, we will be using these as a guide, and we will obviously be reaching out to the community for more input, but just wanted to share our consolidated plan and a little context for you as we move through this process. So this year, for the first time, the city has conducted a community survey so that the community can tell us what they believe the top priorities for funding will be. The survey is available to all Milpitas residents, and it will be posted through March 21st. We will be providing a summary of the results of the survey to the Community Advisory Commission on April 7th. We encourage all of you who apply and anyone in the community to attend the CAC meeting and hear the preliminary results. And then these results will also be delivered to the City Council in our May City Council meeting. And we will certainly update you all with dates and times for all of these events. Okay, so just a few, there we go. Just a few more slides here. So looking back to last year, we received an allocation of $676,413 in formula funding. Formula means essentially what we were supposed to get from HUD in any given year based on their formula for administering funds to each municipality. However, last year was different because we had the CARES Act, which allocated an additional $397,911 in CDBG-CV, which stands for coronavirus funds, and so with all of the funds that we had, including $290,039 in prior year funds that had been allocated but had not been spent, the city was able to allocate $1.36 million. Okay, so that was last year. This year, we have received a third tranche of the CDBG CV funds in the amount of $582,236. We don't have the formula number just yet from HUD, but we always anticipate that number to be about $600,000. And then that number will go up or down based off the final allocation amount, but that's what we are estimating. And then at this time we were estimating approximately 1.18 million in CDBG funding. And then as we're getting closer to the end of the process, we'll start to determine whether or not there's any prior year formula funds that we could reallocate. That's always in flux as old projects start to end, and perhaps there's some funding left over. It won't be very significant, but again, just a TBD on that. So we're estimating about $1.18 million in available funding. Okay, so quick overview for the formula funds. We can't spend more than 15% of the total grant. So that estimated 600,000, we can't spend more than 15% of that on public services. we can't spend more than 65% of that estimated 600,000 on capital projects, and the city can't administer or use more than 20% of the grant on program administration, which also includes fair housing activities, just for anyone that is interested in that. So that's for formula, and this is where it gets a little interesting. The CARES Act offered some flexibilities with the COVID-19 response. And so any project, any public service that is determined to be a COVID-related activity, the 15% public service rule doesn't apply. So for all those activities, we can allocate as much of the funding as we want, as long as we can show the activity is COVID-related. So that goes back to the, prepare, respond for coronavirus discussion earlier on. If the funds if you're applying for an activity that is directly preventing, preparing for, or responding to COVID, then your activity does not count against the 15% public service. And that is what we found to be very beneficial to us last fiscal year, because we were able to allocate a significant amount of funding to public services, well above the 15% cap. And so while our intention is we're not asking for a specific type of activity, we encourage you to apply for whatever activity you feel is most important for your your nonprofit. But that is something that we are going to have to consider is whether or not that is a COVID related activity. So we're encouraging all applications. We don't need just COVID or just formula activities. We are encouraging all applications. Okay, with that, I will turn it over to Sarah to talk about our timeline.
Great, thanks, Robert. Can you hear me okay?
You are good.
Okay, thanks. All right, so this first slide here will just be going over the general timeline and some important dates for this upcoming fiscal year, and then we'll kind of get into what that process looks like. So as you know, the application window for applications for CDBG fiscal year 21-22 opened on Monday, February 8th. And that window will stay open until March 21st. So about 6 weeks there to get your application in. And we kind of, placed this webinar a few weeks after the application window opened, just so we can make sure everybody's clear on the process. We will be meeting with the Community Advisory Commission on April 7th. That discussion, we will present the simplified applications that have come in thus far for this year, and what the activities entail, and also they'll present the results of the community needs survey that we distributed, and also the CAC commissioners will kind of weigh in on where they think the priorities should lie for City Council in terms of the community need and areas of focus for CDBG funding allocation. We'll then bring the results of the CAC recommendations to City Council sometime at one of the City Council meetings in May, and then likely we'll bring back the final allocation recommendation in June for approval by City Council. After the City Council has approved the projects that they'd like to fund, we'll move forward with collecting a more detailed application about the project and all of the requirements that we'll need from each subgrantee. So I'll get into that a little bit more on the next slide. So the application process is a little bit different this year. In years past, we've kind of collected a very full, detailed application at the beginning of the process, and this year we've shifted to make it a little bit easier on anybody who's interested in applying by having just a simplified application as the initial request for CDBG funding for this fiscal year. So agencies that are interested in applying will fill out it's actually a 2-page simplified application now, but a very simple application, which just kind of gathers information about your agency, how much funding you're requesting, the total cost of your project, a description of your project, and then an estimated number of individuals that you will serve. So we'll follow that timeline for presenting that to our commission and our city council. And then once the annual action plan and once the city council approves the annual action plan and decides on the projects that they'd like to fund, we'll ask that the subgrantees submit a full project application and all of the information required to enter into a contract for the upcoming fiscal year. And again, that window to submit the simplified applications is February 8th to March 21st. So now we're just going to pull up the simplified application, kind of go through it step by step, make sure that everybody's clear on the submission process.
All right, can you see that okay?
Yep, looks good.
All right.
So thanks. Up at the top, you'll just kind of fill out your information about your organization and who the point of contact would be if we were to have any follow-up questions about your application. This first question, we're just asking because we need to know, which funding bucket your request would potentially be coming out of. So again, it's not to say that you only activities that prevent, prepare for, and respond to COVID-19 will be considered, but it does affect, which funding source your project would come from. So just to clarify there, you just select if your project is COVID related or not. You'll briefly describe your project, and if this isn't enough space, feel free to, attach another page when you submit it, or, take up as much space there as you need. It is in Word format, so you should be fine. And you'll select which national objectives that your project is intended to meet. So those are the national objectives that Robert went over earlier in the presentation. And you'll select the type of project as well. So if you have any questions about, your specific project that you're thinking of and where those might fall under, we will have a question and answer portion at the end, but you can also feel free to just reach out to us individually so we can kind of talk through that together. And then we will be asking how much you're requesting to implement your program or project and the total cost of the project. The estimated number of low and moderate income residents that you intend to serve. So kind of just, how many people are you going to reach with your project? What's the goal there? And then the last question there is indicating that you are able to meet all of the requirements listed on the next page. So the next page, we just kind of get into the subgrantee reporting requirements. So we'll also be going through this as a part of our presentation, but you'll need to read through this and make sure that your agency is willing and able to meet the kind of extensive requirements that HUD requires in terms of reporting about your project that you're requesting funding for. So at the bottom there is some links to helpful information in terms of what your responsibilities would be, which programs qualify under CDBG, and also I'll link to last year's webinar where we get into the billing requirements. So there is the requirement that you can submit quarterly invoices and reports about the individuals that you served. So you want to make sure before applying that those requirements are something that you would be able to meet. All right, and I think we can just get back to the PowerPoint.
All right, 1 second.
And one thing to clarify here as well, your agency is welcome to submit more than one project. Let's say you have a project that is COVID related and a project that is not COVID related. just you would just submit one application per project that you're applying for. So as long as you kind of differentiate your projects with their own application, then we'll definitely consider every application that comes in. So in terms of submission, oh, go ahead.
Oh, just making sure that you could see the PowerPoint again.
Yep.
Great.
So as far as submitting your application, the application is just those 2 pages that we went over. You'll sign that second, your agency's director will sign that second page, and you'll submit those 2 pages that are once it's signed as a PDF to the email address that's listed here on the PowerPoint. And if you could just title that email CDBG application dash your organization's name, then it'll be a little bit easier for us to kind of sort through and make sure we receive everybody's application. And I'll definitely, reply and say that, and confirm receipt of any applications that come in. So I know the original application was kind of sent out as a big packet, which included the general guidelines of CDBG as well as the application at the end, but it is just those last 2 pages. Print those out and sign it and send it over to me as a PDF, and that'll be your submission of your simplified application. So a little bit more on the public meetings associated with CDBG for fiscal year 21-22. The first public meeting will be the Community Advisory Commission meeting. So as I mentioned before, the commissioners will provide a recommendation on what priorities and areas that they think the City Council should focus on funding. We will, send out information on that meeting and an invitation for anybody who submitted a simplified application to attend. There will be a public comment section of that meeting where, you'll be able to speak and provide some, context for your application and why you believe that it should be funded through CDBG this year. And after that meeting, we will be going to City Council to present the Community Advisory Commission recommendations, to present all of the simplified applications that came in, and we'll have a discussion there. So it's important to note that these City Council meeting dates are, tentative. So it may be sometime later in May and June. We're not exactly sure when yet. So sometime in May will be that first meeting, and then we'll come back to the City Council to get the annual action plan approved and have our final funding projects for the fiscal year. So recipients of CDBG funding, there are quite a few responsibilities that come with that. So I will just briefly go through them. Like I said, they are listed on the second page of that simplified application, and you'll have to acknowledge and sign off that you are able to complete all the responsibilities as a subgrantee. But basically, we're just wanting to make sure that every subgrantee can justify the use of the CDBG funds and show that the activities are eligible and also consistent with the contract that you'll enter into with the city as far as the scope of services that you'll be providing. So we kind of monitor that by the quarterly invoice and reporting process. You'll have to provide, proof of the expenditures, where those expenditures went, who was served. So we'll get into that a little bit more on the next slide. So one important note is that CDBG is a reimbursement-based grant. So your agency must be able to, front the cost of service delivery for the program activity you're applying for. And then it will get reimbursed on a quarterly basis when you submit an invoice and report to the city. You must also be able to provide extensive insurance documentation in order to execute the contract with the city. So there's a list of the insurance requirements on the simplified application. So just make sure, that you have that information and you're able to send it to us. Your agency must have systems in place to collect demographic information of all the residents being served. So the main demographic information that we're looking for that we have to report to HUD is the income levels of the individuals being served. Again, you have to be primarily serving individuals of low and moderate income, and also the race and ethnicity information of the individuals being served. So we ask for that information on our quarterly reports. And, we are able to provide a copy of the quarterly reporting template ahead of time if you'd like to take a look, or you can always reference our webinar from this past fiscal year of how to, fill out your quarterly report and what information is on there. It's a good reference point to see if you're able to collect all the demographic information that we would need. And as I mentioned, you'll have to submit a quarterly invoice and report 4 times throughout the year. There are kind of specific deadlines in order for us to get everything to our finance department and get you paid in a timely manner. And also, you must have the ability to attend city council meetings and commission meetings as necessary to discuss your program activity and answer any questions as they come up. So here are those helpful resources. Again, they are linked on the simplified application, and I'll also go ahead and link them in the chat box as we're doing our Q&A portion of the presentation, so you can easily access them. But yeah, if you have any further information or interested in reading up a little bit more about the responsibilities of subgrantees, about the reporting and billing requirements for subgrantees, or which CDBG activities are eligible, if you had something come to mind and you're not sure if it's eligible or not, that link's pretty helpful. So I believe that is it. Here is our contact information. Again, we'll have a Q&A here shortly, but you can definitely reach out to us individually if you have any specific questions about the project you're applying for or the application process at all. And then that email address at the end is just kind of our general housing email address, and you can use that one as well.
Okay, I think that is the last slide. So I'll go back one, just leave that up for anybody that wants to write that down. So a couple of questions are coming through the chat. If you have other questions, please put them in the chat and we can go ahead and get those answered. One of the questions that came through earlier that Sarah did touch on, can applications be both regular service and those due to COVID-19 needs? And so, yes, we are looking for any and all applications for the activities that you would like to be considered for funding. So it's not limited to a certain amount of applications per subgrantee. It's really, what are the needs that you would like us to consider funding you for? And so the more applications for public service, for COVID-19, whatever you need, the better. So thank you, Jordan, for that question. We got another question here from Ron. Will you be sending out the PowerPoint file and link to the recording for this meeting? Yes, we will be doing that after the meeting. And once the recording is ready, we'll post it to our website, and then we'll send you a link to that website along with the PowerPoint. So thank you, Ron. Another question. If we submit invoices quarterly, does that mean we will only be reimbursed quarterly? Yes, so that is a good question. And that is typically how the reimbursement process works. There are not a lot of activities, few that I'm aware of, that would get fully funded up front. There are some exceptions, but those are really, really, really rare instances. With 99% of the CDBG activities, you will do work in any given quarter, and then you will ask for reimbursement based off of what you've spent in that quarter. And every activity is different, so I don't want to just say that it's a no. So if you have more specific questions, maybe we could talk through your activity, and kind of determine what a more appropriate reimbursement model would look for you. So with any of these, just feel free to reach out to us, and we're happy to answer any questions. What does public improvements include under capital improvements? Good question. Let's go. I'll just go back real quick to the slide that shows. So capital improvements can be a whole host of things. Typically for us, we've seen a lot of funding dollars in public facilities and improvements, and that actually includes like homeless shelters. So we've funded homeless shelters that serve Milpitas residents outside of Milpitas, obviously, because we don't, Milpitas does not have a homeless shelter. With capital improvement dollars, we've funded affordable housing, rental apartment rehabilitation. We've actually funded acquisition of land for development of affordable housing. So there's a lot that can be done under capital. It's really just, what are your needs, and is there a national objective that we can link it to? So if you have any specific questions about public improvements, capital improvements, feel free to give us a shout, and we're happy to set up a meeting and just talk through specifically what that could mean for your particular project. Let's see. What is an example of a consolidated plan for children and youth? So the consolidated plan is sort of the overall plan for funding services. The priorities within the consolidated plan, which include children and youth, an example of that would be child advocates of Silicon Valley. They come to mind. They have court-appointed, they call them CASAs, that help foster youth, and so that would be an example of funding for a public service in one of our public service priorities under the consolidated plan. So anything else that you can think of in the world of helping low and moderate income individuals, children, that fit into one of these priorities, that would be an example of it fitting into our consolidated plan. And Raquel, I hope that answers your question. If it doesn't, please feel free to follow up or reach out, and we're happy to take a call and answer any more questions you might have. Let's see. With regard to the simple application, is the program director or CEO required to sign the application, and must the signature be wet versus electronic? Sarah, do you have any thoughts there?
Yeah, I think, in our discussion, we were thinking the simplified application is really, intended to keep the process as simple as possible. And, we will have a more formal application that comes once your agency receives funding. So I think for that purpose, the simplified application can be your program director, the person that's really in charge of managing the program for which you're applying for funding within your organization. And then, your CEO, we will probably have to have sign the more extensive formal application once your agency receives funding. But for the simplified application, I would say program director is okay. And I think an electronic signature would be fine also. But you can also print it out, sign it, and just scan it as a PDF back to me.
Yeah, and I'll just Sarah is the lead here. I'm eternally grateful for the amount of work that she does to make this process seem smooth, even though I know it's not always as smooth. I will just say, we've all had to gravitate towards remote work. So, if for the simplified application, I think we're more lenient on the DocuSign or eSig. For the formal application, we'll talk internally. But for the simplified, I think we're okay with these signatures. Okay. Hope that answers your question. Thank you very much, Nicole. Really appreciate that. If we're receiving a low mod housing rehab grant, do all the recipients need to fall within low mod income or at least 70%? Yeah, I mean, that goes back to our slide earlier here, right? We want to make sure that at least 70% of expenditures benefit low mod income residents. So, you know, we want to make sure, you know, at least 70% of the expenditures benefit low moderate income residents. So I hope that answers your question, Deanne. Thank you. Did I see that one of the public service priorities included health? Let's see. Well, we have health is certainly a top priority. That would probably fall under other community funding public services. So there's not something specific to health, but you know, it's still very critical, and we believe that that's an important aspect of funding for the community, especially now. So yeah, we would encourage you know, health-related applications, you know, that would fall under community funding / public services. Thank you, Wendy, for that question. What is the minimum amount that you will grant? So I believe the number is $7,500. We understand that these are very labor intensive. So, you know, but we're not trying to determine the number that you apply for. You are certainly entitled to apply for whatever number you feel works best for your nonprofit. But yeah, the minimum number that we would allocate is 7,500. Okay, well, I don't see any other questions coming in. I'll go back to the end here just to put up our contact info. And I know I saw another question come through, so get to that in a second. For the community, this is a good question. For the community survey, will you have preliminary results available before simplified application is due in March? We will be tabulating the results at the end of March. So we won't have the results of the survey before the simplified application is due. So it will be presented to the CAC on April 7th, and we'll be working hard to get the information summarized and digestible for public consumption by then. So won't be ready before the simplified applications are due. But thank you for your question, Linda. And yes, I apologize. I had two numbers in my head. So back to the question on minimum grant, we had internal discussions about raising it to 7,500, but it is actually 5,000. So I apologize. I had two different numbers swirling in my head, and so yes, the application grant, the minimum grant is 5,000. We have had internal conversations about that because we know that these are very labor intensive. And so sometimes 5,000 is not sufficient enough to warrant, you know, applying for the grant. But that's why I say apply for a number that works for you. But yes, the minimum grant is $5,000. But again, we encourage you to apply for a number that is that works best for your organization. Thank you. Okay, Sarah put some other helpful links in the chat. Again, we will record this. We are recording this presentation, and we will send a link to that when it is ready. If there are no more questions, I will just take a moment to again thank Sarah for the tremendous amount of work that she does to coordinate all of these presentations and meetings and updates to you all, and applications and questions and answers. You know, I'm really grateful for all the hard work that she does, and I think all of you have shared similar sentiments. So just again, thank you, Sarah, for everything that you do to try to make CDBG a reasonable process for everybody. I know that's not always the case. And then finally, thank you to all of you attendees. You know, you guys make the CDBG process what it is. So, you know, we appreciate all the work that you do in our community. And we look forward to helping you, provide more resources to our residents in the coming fiscal year. If you have any other questions, you have our email addresses here. Please feel free to reach out to us. And yeah, we look forward to hearing from you all. Thank you all very much.
Hey, can you hear me?
I can.
Having some reading issues. Yeah, thanks everyone. We'll hang out for a little bit if you have any other questions that come up. And yeah, thanks, Robert. It's definitely a team effort, and you're the real CDBG expert. So I appreciate it.
Yep, $7,500.
Wishful thinking.
Real expert. No, it's funny because I was thinking in my head, I was like, wait a minute, we didn't change that as soon as I said it. And thanks, Georgia.
I was like, oh, you're just making a decision. I like it.
Yeah. I thank you, Georgia. I know you're still on the call. I just want to say thank you. You're the best. Appreciate that, Georgia. Thank you. All right. Well, there's a few more people here. Hey, Wanda. Any other questions? I'm gonna hang out here for another 5-10 minutes just to make sure anybody's final questions get answered. Well, this is what the most attended meeting we've ever had.
I think so.
28 is what I saw.
Pretty impressive.
Good save on the yeah.
I was like, oh no.
Yeah.
Always something.
Hasn't exactly been determined that we'll be moving it. We'll see, but yes, the meeting's done. We're just in case anybody had any additional questions, we were just going to hang out. So we said till 3. So it's probably okay. We could probably disconnect the meeting now. Thank you, Mike and Rochelle. Really appreciate all your effort.